Good afternoon everyone, I am Hazel from Motherhood.com.my. Today we are at week 2, Ask Me Doctor weekly Q&A session. Late motherhood is on the rise. Whether you're trying to conceive at 20s, 30s or 40s, there are different pluses and minuses. We are very fortunate to have Dr. Tan, Obstetrician and Gynaecologist from Tung Shin Hospital, to be with us today to answer all your questions. A lot of mom-to-bees have submitted their questions on our platform, so we are going to tackle them one by one now. Are you ready, Dr. Tan?
Okay, sure.
Awesome, let's get it started. So first of all, I've categorized the questions into 5 main categories. We'll start with the first one, general pregnancy. So the first question, does age affect fertility? How old is old to get pregnant?
So we start from the very beginning. So as we know that in women and females, there are ovaries, and ovary is the place where oocyte, which is normally known as eggs, are formed. So at birth, female ovary contains roughly about 1 to 2 million eggs. So when you reach about puberty, and you only have about 25% of it remain, say roughly about 300,000. Now, one thing to remember is, in general, female do not make new eggs, and whatever you were born with, the number will just decline continuously throughout the time. So over the next 30 to 40 years, the entire egg supplies will be depleted, and which is when women reach menopause. So one thing to remember that 1 to 2 million oocytes sounds a lot. Puberty is 25% left, 300,000 sounds a lot. But you have to understand that not every of these eggs will reach full maturity. So generally speaking, roughly about 300 to 500 of these eggs will reach maturity throughout your entire lifespan. So how does age affect the pregnancy? So we can start by talking about when the female is very young, teenage pregnancy, versus the standard age, and versus the elderly mother, advanced maternal age. So when they look at teenage pregnancy, they found that if you are in between 13 to 16 years old per se, your risk is very much higher. So the risk includes premature delivery, small baby, a baby with very low birth weight, and because the suggestion is that at that point, the teenagers, the body is still growing, the mother requires nutrients to grow, so there's a competition between the mother and the baby fighting for the nutrients. They also find out the baby will have more mortality, and because the nutrition is in place, generally speaking, teenage pregnancy will have higher risk of anemia. Now, other things such as complication per se, we know that the mother is still growing, sometimes the pelvic is still immature and still small, so there is a higher chance of obstructed labor, which means the baby may not be that easy to deliver normally.
So we do not encourage preteen pregnancy because you might be fighting nutrients with your baby, and because you are in puberty, you are growing, you need more nutrients, and your baby at the same time needs nutrients to grow as well.
So that is for teenage pregnancy, a very young age, and now we are looking at very advanced age. No, it's a very advanced maternal age. Generally speaking, they label the mother as an advanced maternal age after the age of 35. So as we know, if we grow older, when we are older, we have higher chance of getting high blood pressure, diabetes. So same thing as well. When you are older and you are getting pregnant, this risk when you are pregnant is also higher. So generally speaking, when your age advances, you have a higher chance of having hypertension, diabetes, smaller baby, premature birth as well. And the most important thing to realize that is the birth defects actually increase when you are older. So if we're looking at the age of 20 years old, for one mother to have Down syndrome, maybe 1,500 mother, only one case. But when you hit 35 years old, it's roughly about every 270 mothers, you will have a chance of having a Down syndrome. Once you're 40 years old, it's every 100 mothers, one Down syndrome. And when you're 45 and above, it's more than 1 in 50 mothers. So as your age advances, birth defects goes higher, the complications is also higher.
What is the perfect age to have a baby?
So the perfect age to have baby, number one, is not during the teenage time, and you need times for your body to grow into a mature, to have sufficient nutrients, and you have fully grown And also we advise not to be too advanced as well. So in between 20 to 35 would be a rough suggestions. And how old is too old to get pregnant? If you're just looking at getting pregnant per se, you are possible to get pregnant until you hit menopause. So basically, any time before you hit menopause, you are still likely to get pregnant. It's just the risk associated with it is gradually increased as you age.
Doctor, you also mentioned about menopause. So what is the general age of women starting to have menopause?
It depends on the population, but we're looking at roughly between the age of 45 to 55 years old. Yeah, roughly this is the numbers we see in the general population.
Thank you for your explanation, doctor. Now let's move on to the next category, about late pregnancy. If I am pregnant after the age of 35 to 45 for my firstborn, what are the things that I should take note?
So as long as you're menstruating, you can get pregnant. It's just the risk getting higher and higher as we age. So if you mentioned just now, if I'm age 35, what are the things I have to take note compare when I'm younger? The things we mentioned before is the risk associated, especially the risk of birth defects, Down syndromes. So one may consider that when you reach the age of 35 and you're pregnant, you may start considering antenatal screening. Now, antenatal screening comes in a few forms. One of it is by ultrasound to look at the nuchal translucency, which is the thickness of the neck of a baby. This is normally done between 11 weeks and 14 weeks. That will give a rough idea of what is the risk associated with Down syndromes. And together with a blood test, which is a serum blood test to look at the biochemistry, this is known as the first trimester screening. Well, it gives you an idea, a calculated risk of how likely you are to have a Down syndrome baby. Now, some mother may find out that they are pregnant much later on, which means beyond 14 weeks, maybe in the second trimester. There is also a different set of blood tests, and this is known as the triple test or quadruple test. This is also looking at the serum biochemistry and give you a calculated risk of the likelihood of you having a Down syndrome baby. Now, the latest test that everyone is talking about right now is the non-invasive prenatal testing. Now, this test can be done when you are 10 weeks pregnant onward, which is 2.5 months. And this test is to extract the baby's genetic materials from the mother's blood and using that to directly look at the baby's chromosome. While for looking at Down syndrome itself, the accuracy can go up as high as 99.4%. So this is for the birth defects per se. Now, as we know, as we age, you have a higher risk of getting diabetes, also high risk of getting high blood pressure. So of course, every time when you come for checkup, we will measure your blood pressure. And when you are 28 weeks pregnant roughly, then we will do a glucose tolerance test to look for any diabetes.
3 miscarriages in a row and already in her mid-30s. Is there any chance that this time it could be a healthy pregnancy with a healthy baby? If yes, what are the chances like?
So I'm assuming that both the 3 miscarriages has been managed by obstetricians and gynecologists. So if you have 3 miscarriages in a row, I'm sure that a few tests will have been carried out for you. There are a lot of causes of it, but majority of the causes is unknown. Well, so basically all the tests we are trying to do is to find the one that can be explained and the one that has a treatment so that we can treat it accordingly to prevent further miscarriages. Now, one thing that is possible to diagnose and possible to treat is antiphospholipid syndromes. So now in these syndromes, they will normally take a blood test to look for the antiphospholipid antibodies, such as lupus anticoagulants, anti-cardiolipin antibodies. So if this is detected and if you have recurrent pregnancy loss, then your doctors will advise you that most likely you will need to have treatments when you are pregnant. Now, other things to think about is that if a mother, whether she have any other underlying diseases such as hypo or hypothyroidism, so normally the thyroid function test will be tested as well. Now, this is looking at the hormones and looking at the underlying syndrome. Sometimes a mother may have an abnormally formed uterus. So the doctors will normally do an ultrasound, both trans-abdominally or trans-vaginally, to look at the shape of the uterus. If there's any suspicion that the uterus is not in the normal shape, then they may carry out an MRI to look much closer of the anomaly there. Now, other things they can consider is when you have miscarriage, the product conception that was passed out, we can potentially send it for cytogenetic testing, which is to test for the genetic materials of the baby to see if there's any syndrome that is causing the recurrent miscarriage. If that is identified, then we can start screening both parents to see if there's any genetic abnormalities.
Thank you, doctor. Let's move on to the next questions for women that want to get pregnant again. So for the following question, if a woman is pregnant again 2 months after delivering her first baby, does becoming pregnant too soon put risk on her or the baby?
Yeah, so if it depends, the first one is normal vaginal delivery.
Right.
Yes, it is definitely higher risk because your body has not fully recovered yet, and when you deliver the baby, you will lose some blood, and your body will need some time to regenerate your red blood cell again. So when we say it's less than 6 months in between your delivery and your next pregnancy, then we call it a very short inter-delivery interval, and generally speaking, it's associated with high risk of anemia, preterm labor, smaller baby, and miscarriages as well. Now, let's say if your first child is a cesarean section, we normally advise to wait for 2 years before you get pregnant again, as your womb, your uterus needs time to heal. So if you're pregnant so soon, your next pregnancy will carry a much higher risk of uterine rupture or uterine dehiscence when your baby is about to be born. So when you are contracting, about to give birth, if you had a very recent cesarean section, the scar may not be fully healed, and you will stand a much higher chance of a uterine rupture during the process, so it's quite dangerous for them.
So it depends that her first pregnancy is vaginal birth or cesarean.
Yes, so normally speaking, if your last cesarean section is very soon, very near, we don't recommend vaginal birth, we recommend a repeat cesarean section just because the risk of the uterine rupture is higher. Either vaginal birth or cesarean section, we generally advise for 2 years. For the cesarean section per se is to allow time for the wound to heal, and for vaginal birth per se is a few reasons. Number one is for your body to recover, and also for your mental health as well, so that at least your first baby is slightly bigger before you have another smaller baby.
So generally speaking, after your first pregnancy delivery, you should wait and have a rest for about 2 years before your second pregnancy. The next question is on young pregnancy. I think doctor already answered it earlier, which if a woman gets pregnant at the age of 20, will the baby be born with a disability?
If you're looking at the literatures, the articles and stuff, most of the adverse outcomes is actually associated with teenage pregnancy around 13 to 16 years of age. So it's much earlier than that, when the body is not fully developed yet. So that is when things can go wrong. So I mentioned before that the premature delivery is higher, and they found out that for those who deliver before 32 weeks of gestation, it is highest among the age between 13 and 15 years old. Baby will tend to be smaller than it's supposed to, a lower birth weight, because the mother is competing for the nutrients with the baby. The baby born will have a higher risk of mortality. The mother, because of nutrition wise as well, will have higher risk of anemia, and also a much higher likelihood of obstruction in labor, which means difficult to deliver normally, as the pelvis may still be immature. And as they are still young, after delivery, they will have a higher chance of a postnatal depression, and sometimes it's difficult for them to sustain the breastfeeding.
Okay, now we come to our final category, is about delivery. Is it true that if a woman constantly experiences period pain, it will be easier for her to give birth? Will period pain disappear after childbirth?
So now the first thing is to identify what is the cause of the period pain. I think most of them are interested in the period pain that is caused by a condition known as endometriosis. Now, endometriosis per se is very sensitive to hormones. So when you are pregnant, the hormones that is released during the pregnancy may actually suppresses the menstrual cycle and alleviate the symptoms. So when they are pregnant, they have felt that whatever they feel, the pain is much better. However, it doesn't mean that the pregnancy cures the period pain, cures the endometriosis. And this thing will generally come back after giving birth. So when the menstrual cycle has returned, then the pain may slowly come back. So this is one of the reasons And it's actually one of the commonly asked questions as well. It's a myth about whether pregnancy itself can cure endometriosis.
Now the next question is quite interesting, and a lot of people asking the same. Is it true that giving birth the second time around is easier compared to the first one?
Okay, if we are looking at just the delivery part per se, if the first pregnancy is a vaginal delivery, then yes, the subsequent vaginal delivery will be getting easier for the mother. But if your first pregnancy is a cesarean section and the second one is a vaginal birth delivery, then it won't be any easier in comparison because it's the first time going through the vaginal canal.
Can a woman have cesarean more than once?
Actually, yes, the answer is yes for that. If your first cesarean section is uneventful, there is no complications, and you have enough inter-delivery interval, say 2 years of rest before you get pregnant again, so the subsequent delivery, you can try normal vaginal delivery. The success rate is actually quite high, about 72 to 75% of the mother with a previous cesarean section can deliver vaginally. So if they manage to deliver vaginally, then the third, fourth, fifth pregnancy they can deliver vaginally, and there is not really a limit of how many baby you can have. But if let's say that the first one is cesarean section and the second one is also cesarean sections, we generally advise that 3 cesarean sections you should consider stop around there and not anymore. There is no absolute number of how many cesarean sections you can have, but generally speaking, the more cesarean section you have, the higher the risk for your next pregnancy, which is why we generally advise that if you already have 3 cesarean sections, then maybe it's time for you to consider whether you still want to take the risk to have another one afterwards.
How do women with Colossus manage pregnancy and delivery differently? Is it possible for them to have a natural birth, or do they have to go through an operation to deliver a child? Will Colossus symptoms get worse during pregnancy?
Well, it's a very specific question, but unfortunately we need more details. Actually, scoliosis is a range. Some will just have a mild scoliosis, some may be very severe. So it depends on the severity itself, then the answer will be completely different. So normally it's a joint discussion between the bone doctors, the orthopedists, and also the obstetrician. So both will have to sit down to discuss the case, and it will be an individualized approach depending on the severity of the scoliosis.
Thank you, doctor, for your explanation. Before I end our interview, do you have any advice for pregnant women?
Well, what I can advise is everyone is different, so there is no one rules that fits for everyone. So every single pregnancy, we will have to assess it individually and to find out the best plan that's tailored to you. So the best thing to do is actually discuss with your obstetricians and go through your history, because everyone is different, so everyone will have a different risk, and the advices, the whole pregnancy journey will be managed differently as well.
Thank you, GetDoc and Dr. Tan, for answering our questions today. Just to share more with our viewers, for 3 ringgit a month or 36 ringgit a year, GetDoc Plus allows subscribers to enjoy discount or concessionary rates when you visit partner clinics, or when you visit GP or ONG specialists, or even a health screening. So sign up today so that you can make your appointment before your next consultation with Dr. Tan. Stay tuned for our next weekly Q&A. Remember to submit your question before Thursday and stand a chance to win free 2-year subscription of GetDoc Plus and also 100 ringgit of free Motherhood.com.my gift voucher. Thank you. See you all next week.